Hi, my name is Amelia Brown. Should teenage girls be allowed to get on birth control without the permission of their parents? 3 in 10 teen American girls will get pregnant at least once before age 20. Teen pregnancy is very common and is getting more common every day. Birth control is a common pregnancy prevention choice for most women and young adults. Most teenagers are too afraid to ask their parents to go to the doctor to get on birth control or some other form of pregnancy prevention. That leaves teens with only one other option: condoms. In various studies, between 0.8% and 40.7% of participants reported the experience of a broken condom. In some studies, the rate of sex with a broken condom were as high as 32.8%. Teenagers should be allowed to get on birth control without the permission of their parents because it would lower the teen pregnancy levels. If teenagers were given the opportunity to take birth control without parental consent, the number of teen pregnancy incidents would decrease. The sex talk. It's that awkward talk every girl's afraid of having with their mother. According to Planned Parenthood, 42% of parents say they've had the talk with their children about how to abstain from having sexual relations. However, only 60% of parents are talking to their children about birth control. This means that 40% of teens have not had the opportunity to discuss these options with their parents. Many teens will find answers on the web, from friends, or just not look at all. Even though parents are having the talk with their teens, kids will be kids. In the United States, 46% of all high school age students and 62% of high school seniors have had sexual intercourse. This information shows that even though parents are discussing sexual activity with their children, teens are still being sexually active. Therefore, parents should not only discuss with their children about abstinence, but also about safe sex. In 2012, a total of 305,388 babies were born to women ages 15 to 19 years. Even though the percent has decreased over the past few years, the number is still astronomical. If parents would have those hard to discuss moments with their children, they might find out that it is too late for abstinence and it is now time for prevention. Teenage girls should be given the opportunity to take birth control. Without parental consent, for this option to take place, a teenager would need to see a doctor and discuss all options prior to beginning birth control. The doctor may ask about your sex life, how many people you've had sex with, what kind of birth control you've been on, etc. You could also ask your doctor any questions you have about birth control and what type would work best for you. This will help the doctor with giving you advice on what he thinks you should take to benefit you most for your health. Before any physician will prescribe you with birth control, they have to check to make sure you are healthy enough for it. Usually you don't need a full exam to get birth control, but what happens at the doctor's depends on your personal health, the doctor's policies, and what type of birth control you want. Your doctor will want to talk with you about your medical history and check your blood pressure. Then if you and your doctor agree on the same type of birth control, he or she will prescribe you it and you will be able to begin taking it. If teens were allowed to get on birth control without parental consent, teen pregnancy percent would not only decrease in number, but there would be a lower number of STD and STI percents in teens. And puberty side effects would decrease. For teenagers to start using birth control, they have to see a doctor, forcing them to go to the doctor. While at the doctor, many will test them for different types of STDs. Today, 4 in 10 sexually active teens have had an STD that can cause infertility or even death. That percentage of the teens that are being checked, that does not include the teens that don't even know they have an STD. STDs often have no obvious sign or physical symptom, so regular screenings are critical, making it possible for adolescents to not even know they have an STD or STI. Not allowing adolescents to get on birth control without parental consent could essentially alter their lives forever. Besides pregnancy levels and STD percents decreasing, the side effects of puberty in teens would decrease as well. Birth control pills can improve acne for moderate to severe acne, which other medications can't cure. Birth control pills may be prescribed. The hormones in the birth control pills can help stop acne from forming. Many teens suffer with acne and have tried many medications to try and fix it, but are too afraid to ask their parents to try birth control. Along with the breakouts, teenage girls with puberty, they also help the pain of menstrual cramps. Birth control pills can offer significant relief to women with painful menstrual cramps. From the menstrual cramps to the breakouts, birth control can help take away from those unwanted puberty side effects. As Torian Belluccio once said, being a teenager is chaotic because you're afraid of coming into your own. But you're not an adult, you're fighting with your parents over responsibilities and freedoms. Allowing children to be on birth control without their parents' consent is just one way adolescents will be able to show that they are growing up and becoming a mature adult. No matter how much parents like to think their sweet little teenagers aren't having sex, there's a huge chance they are. It's better for teenagers to be able to talk to a doctor than no one. Essentially solving many problems for adolescents, like preventing pregnancy, controlling puberty symptoms, and testing them for STDs. Every day, adolescents are getting pregnant, and allowing them to get on birth control without the permission of their parents is just one step in solving this problem. Thank you.